Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for fatty liver disease. What is fatty liver disease? Fatty liver is a diseased condition of liver in which fat is deposited in the liver tissue. Note this, within the tissue space of the liver, fat has been accumulated. What are the types of fatty liver disease? Two types are there: non-alcoholic fatty liver disease, NAFLD, alcoholic fatty liver disease, which is also known as alcoholic steatohepatitis. In fatty liver disease are generally represented in the picture as yellow because fat is yellow in color. So normal color brown, that is replaced by yellowish color. This is fatty liver. What is non-alcoholic fatty liver disease, NAFLD? As the name implies, fatty liver disease not related to use of sufficient alcohol is known as non-alcoholic fatty liver disease. What are types of NAFLD? Two types are there: simple fatty liver, in which there is a little fat in liver but no inflammation of liver cells. It doesn't cause any liver damage or complication. Number two, non-alcoholic steatohepatitis, NASH, wherein there is accumulation of fat, inflammation of liver cells and damage of liver tissue are there. NASH may cause serious fatty liver damage disease. However, this is not irreversible. That is, NASH to normal liver is possible. That is, from non-alcoholic steatohepatitis can be reversed to normal liver with proper treatment. That has been shown here. This is normal liver, then NAFL, then NASH, then again normal. Or in this way it can go worse also. And this is healthy liver, fatty liver and non-alcoholic steatohepatitis liver. Look, these look almost same. What is alcoholic fatty liver disease, AFLD? As the name implies, fatty liver disease related to too much consumption of alcohol is known as AFLD, who are predisposed to fatty liver disease. Pre-diabetics or type 2 diabetics, obese persons, middle-aged or older persons, persons with high cholesterol, triglyceride and high BP, persons taking corticosteroid or some cancer-related drugs, persons with some metabolic disorders, persons losing weight rapidly, persons suffering from some infections such as hepatitis C, person exposed to certain toxins, person used to consume liquors. This is the FLD picture in the microscopic view of the liver tissue. This is normal view of the liver tissue. These yellow dots are fats. What are signs symptoms of fatty liver disease? Fatty liver disease is mostly silent in nature. Some feel too tired. Some experience discomforts around upper side of abdomen. Too weak, too tired. And this is in the liver region, some uneasiness. How is fatty liver disease diagnosed? Subject's medical history and lifestyle, physical examination, liver function test, and imaging, especially magnetic resonance imaging. When to consult a physician? Whenever one suspects that there is problem with one's liver or one feels too weak, one must take advice of a general physician. How to prevent fatty liver disease? Objective: avoid food items that cause chronic inflammation, oxidation in body. Get enough foods and drinks containing antioxidants, because this prevents inflammation, chronic inflammation. Keep body weight and blood sugar under control. Perform workout daily for 20 to 30 minutes. That's exercise, simple exercises. Strictly control alcohol, other addiction, full fat consumption. Avoid all types of meat, all sorts of canned, bottled foods, drinks. Get fish and seafoods. Get fresh fruits and veggies daily. Get whole grain, nuts and legumes. Use olive oil in cooking. Get green tea, coffee, raw garlic, Berries, vitamin E rich foods. These contain antioxidant effective to stop inflammation in liver. Finally, there is a lot of OTC drug. This is allopathic modern medicine, over-the-counter drug, which any person can purchase without the prescription of any doctor. That causes drug-induced hepatitis. Take careful. Like acetaminophen is a very common culprit for causing hepatitis, drug-addicted hepatitis. Please avoid this carefully. There is some foods and shown here. Please look into it. Now we are taking the remedial part. Calamure fatty liver disease, jaundice. Pain in hepatic region, tongue with white or grey coating. Stool light yellow, constipation, piles. In absence of other specific symptoms, if tongue symptoms and jaundice are there, this is almost specific for fatty liver disease. Fluoric acid for fatty liver disease. Ascites from hepatic induration and portal congestion owing to alcoholism. Craves refreshing drinks, hungry always. Feeling of fullness and pressure in epigastrium. This region is called epigastrium region. Just below the sternum. Central region is epigastrium. There is right hypochondrium. This is left hypochondrium. Constipation, piles with scanty pitted dark urine, skin shallow, sleep disturbed. Subjects cachectic, flabby, broken down, always feel too hot, likes to bath with cold water. Despite broken down condition, works hours after hours without fatigue in cold and hot weather. This is the characteristics of fluoric acid patient. This is characteristic fluoric acid patient. And fluoric acid patient can perform works hours after hours without any weariness. This is their characteristics. Though he is diseased, yet this he or she can do. Silicate for fatty liver disease, abscess of liver, heart, tender with pitting soreness or throbbing, ulcerative pain in liver, worse from motion, touch, lying on right side, burning or throbbing in pit of the stomach. Pit of the stomach, this region is called pit of the stomach. Just this is sternum bone. Just below there is a pit. That pit is called pit of the stomach. Aversion to warm foods, desire only for cold things, painless diarrhea with exertion and constipation from inactivity of rectum. Subjects very chilly, lack vital heat, wants to dress with warm clothing even in summer. Often they are cachectic, lack physical mental grit, skin unhealthy, little injuries faceless, discharge are thin and offensive. Mind this. These subjects, this line, these are the symptoms of the person and these are the symptoms of the disease. Mind it, these two must match. The disease symptom, more important is subject symptom than disease symptom. If two symptom matches, then it is well and good, very good. But if the patient symptom doesn't match, the medicine will not be acting curatively. It will give transient effect. Sickle core for fatty liver disease. Acute excruciating pain in hepatic region, tongue coated with a thick brown tenacious substance. Hepatic region, this region is called hepatic region. Right hypochondrium, hepatic region. Inflammation, enlargement, gangrene of liver. Is more than inflammation. It is already gangrene, advanced stage. Burning in throat, unquenchable thirst, great weakness, limb cold, covered with cold sweat. These are patient symptoms. Last line. Natamure fatty liver disease, malarial cachexia, full, heavy, aching about liver area after eating. Worse as digestion progresses, skin yellow, are the stitching pain in liver, spleen, worse from every motion with obstinate constipation, mapped tongue. This is characteristic of natamure. Subjects like to stay alone, avoid fuss, don't like consolation from others, either tend to take free salt or avoid salt altogether. This is individual symptom, man symptom. This is not disease symptom. Natamsal for fatty liver disease, jaundice from vexations, from excessive mental work, soreness in liver with sharp stitching pain, Tongue greenish yellow. Tongue greenish yellow. Let them solve. Brown or brown at base. Shallow yellowish face. Vomiting of bile. Words lying on left side. Subject drowsy. Words in forenoon when reading. Suicidal melancholy. Suicidal melancholy. Words from music in morning. Stool dark green. Bilious. Urine loaded with biles. Worse in damp wet weather, better in warm dry weather. Urgent need for fatty liver disease. Cirrhosis of liver. Cirrhosis from malarial cachexia, sorry. It is advanced. Cirrhosis means advanced stage. It comes after fibrosis. After, see, we are talking about fatty liver. Now, fatty liver, after fatty liver comes fibrosis, then comes cirrhosis. It is an advanced stage of liver disease actually. Peculiar fullness in liver, occasional drawing and stinging pain, especially when walking, sometimes reaching into chest, periodical dull stitches in the anterior surface of liver, hepatic affection resulting in fatal dropsy. Hepatic affection always results from dropsy. Say the ankle, over the ankle there is accumulation of tissue fluid. In the abdomen it is accumulation of tissue fluid. These are liver affections symptoms. Subject very nervous, great apprehension when getting ready to keep some appointment. Diarrhea starts. They feel chilly when uncovered. Again feel smothered when if wrapped up. Crave sweets, sugar, salty foods. These are characteristics of adjunctant nitrica. Person. Alumina for fatty liver disease. When stooping, liver as if bruised. Stitches when rising again. Tearing pain from liver to hip with stitches with both hypochondria. This is hypochondria. Right hypochondrium, this is left hypochondrium. Both hypochondria. Worse from motion. They feel time passes too slowly. Alumina patient feels the time passes too slowly. 1 hour seems 3 hours to them. They are very hasty, hurried, very sad with variable mood. Seeing sharp instrument or blood impulse come to them to kill themselves. That is suicidal tendency to seeing sharp instruments and blood. This is alumina characteristic. Calcarea curve for fatty liver disease. While walking, pressure in hepatic region with every step, stitching pain during and after stooping, enlargement and induration of liver, abdomen epicastem sensitive to pressure, abdomen distended hard, cold feet at night in bed. Cold feet at night in bed is a characteristic symptoms of calcarea curve. It will be present always if the patient is of calcarea curve. This will be always there in all diseases. Arsenic alb for fatty liver disease. Painful bloatedness in right hypochondrium with burning pain. Burning pain is characteristic of arsenic alb. Vomiting of black materials, black stool. This is also characteristic by arsenic. Black, any emission from the body is black. Stitches in right hypochondrium extending to gastric region. Hypochondrium. Gastric region, this region is called gastric region. Gastric region ending in violent pressure over the whole abdomen. Over whole abdomen. Perforation of stomach, intestine, burning heat of skin, very quick pulse, anxiety and restlessness. Anxiety, restlessness is characteristic symptom of arsenic alb, always there. If it is arsenic alb patient, there will be anxiety, restlessness and mind always. This is the abdominal quadrant of 9 quadrant has been shown here. It is very important. Please note this. This is the abdomen is divided into 9 quadrant. Upper 3, epigastrium, right hypochondrium, left hypochondrium, umbilical region around navel, right lumbar, left lumbar, hypogastric region, right iliac, left iliac. With this, the video ends. Thanks for listening and viewing. If you got anything to say, please write it in the comment section. I will certainly respond.